So I'm an urban planner by background, and I'm currently working at UE in the WHO Collaborating Centre for Healthy Urban Environments. And the centre's been sort of at the forefront of healthy urban planning for sort of the last sort of 15 to 20 years, really trying to get local authorities and communities engaged in the idea about how the built environment affects people's health and well-being. And what I thought I'd contribute to today's discussion, which is around how do we know if a city's healthy, is not just the idea about looking at a sort of a snapshot, as Liz was sort of saying, and looking back about whether or not the city's healthy now, but how are we making sure that the city in the future is going to be healthy, and we're making all of the decisions and the changes and the choices that we're making today are contributing to a better future for our future generations. And being a planner, I'm going to focus on sort of the planning system and looking at how individual developments can make a positive contribution to the future health and well-being of our cities. And I'm proposing that that we look at a sort of a health check for each and every individual development, because it is those individual developments that cumulatively offer the greatest opportunity to inflict a kind of citywide change across our cities. It's not just the big urban extensions or the big developments. It is these little changes that happen every day on a week-by-week basis that have the biggest impact on our communities and cumulatively can have the biggest kind of effect. So I'd like to propose that any indicator for health and well-being, covering the things that Liz and Joe have already talked about, this sort of holistic approach to health and well-being, not just taking an economic one, but looking at the health of our people and our places and the environment as well. And making sure that we are taking these proactive decisions on a day-to-day basis, and making sure that they are thinking integratively about how they're contributing and cumulatively, and we're really looking at this sort of more ongoing maintenance and monitoring and influence for the way that our city is shaped and is moulded into the future. And I think that offers a greater opportunity also to link with the more traditional ways of kind of measuring and data collection and things like that. And I think here in Bristol, I don't know if you're all aware, but they have a quality of life survey which they do every year, and it collects really important information about how a city is used and how people are feeling about their city and their day-to-day activities within that urban environment. So I think linking more strongly the kind of urban planning development process with some of the more traditional data sources, which Daniela will also talk about, some of the more health-based ones as well, I think is really important, and it's an opportunity to bring together multidisciplinary action so that we can get better outcomes for our cities.
Thank you, Sarah.